When it comes to surgery, insider Dr. Georgiy Brunsovanik says there are lots of advances in medicine that can lower your risk for complications. Here's what he said about preventing infection.
So there's some great evidence now that a much stronger antibiotic called vancomycin, which is a big gun when it comes to bacteria, is better. So
right.
I'll give the patients NSAF, like to follow the standards. In fact,
before the surgery.
Right.
Okay.
In fact, I'll give them instead of 2 or 3 doses, and then I will also give them vancomycin. And then if that wouldn't be enough, I also put vancomycin powder in the wound. And the studies on using vancomycin powder are very optimistic in really avoiding infections.
You cover all your bases. I like that.
Oh, but that's not even all.
Okay.
Now, if a patient has a very large adipose layer, the risk of infection goes up exponentially, and there's great studies on that too. So Joel Mara, who is a joint replacement surgeon, showed that in patients with very high BMI, after closing the wound, they would put this little suctioning sponge right on top of the wound, and it would be attached to a little machine, like a little briefcase that patients would carry.
Okay.
And this sponge just kind of provides gentle suction to the wound, essentially removing the food that bacteria would otherwise be feasting on inside the wound.
When you say the BMI, you see these are your body mass index patients who are a little overweight.
Very overweight.
Very overweight.
And
okay.
very overweight patients are at an increased risk of an infection. But you know, there are people, if they need surgery, they need surgery. You know, you can't just tell somebody who is very overweight and in pain, well, you just have to lose weight. I mean, that's inhumane. So they do go through surgery knowing that they have high risks. Well, the wound vac has been just a miracle. And in Joel Mara's study, they showed a significant decreased risk of infection rate. So I'll use that technique as well for patients that are high risk.
Well, I like that, Dr. B. You cover everything. I like it. Now, let's talk about what else can put you at increased risk for infection. And we have a list of some preoperative conditions that can affect your outcome. And so can you walk us through these? We mentioned, I know you mentioned obesity briefly in your discussion, but diabetes is also a big one.
It's a big one. It's a source of a lot of concern. Higher average blood sugars increase the rate of tissue oxidation, which means aging of tissues, and bacteria love sugar. So with diabetes, the goal is to get optimal control before surgery and then to maintain optimal control after surgery. Now, while you're in the hospital, that's easy because I can use insulin, and with insulin, you can control sugar reliably. But when patients leave the hospital, it's very important for them to maintain good blood sugar and sort of pay attention. If they're checking their blood sugar, check it more often. Smoking is another easy one to discuss. There's been a multitude of articles talking about how smoking is a problem and how it just ruins surgical outcomes, and not just infections, really just, there's a problem with smoking on every level.
Right.
Hypoxia, nicotine, malnutrition.
So if you have a patient that's a smoker going into surgery, what do you do?
Well, that's a tough question. So I will deny them surgery.
You will deny them?
With 1 or 2 exceptions. If the patient is at risk of being paralyzed, which is rare, very rare, then the patient has to understand that they're at an increased risk of an infection, but in their situation, you may have to take that risk. For the most part, I ask smokers to stop smoking for at least a month, and then we'll go through surgery with a significantly improved risk profile.
Okay. Now, when you even have a weakened immune system, though, that's a little difficult also for surgery.
Another one, but that's something where the patient really can't do anything. So, for example, I'll operate on patients that are very elderly or patients who have had weakened immunity because of cancer or chemotherapy. You have to really be objective with the risks, and you have to discuss this with patients at length.
Absolutely.
I believe in a consultatory sort of model where the patient has to be aware of what they're getting into, but sometimes there's no option. Sometimes we have to make, brave decisions in order to save a patient's ability to function or their life. So these are difficult decisions, and with rheumatoid patients particularly, one thing we can do is, if the patient can tolerate it, lower their immune modulating medications for sometimes as long as a month, and then that will mitigate some of that risk.
Now, a study from the Journal of Neurosurgery found that patients who had an epidural injection 3 months or less prior to surgery had an increased risk of infection. Why do you think that is?
Well, steroids are the great anti-inflammatory, but there's a negative side to having such a strong anti-inflammatory effect. Steroids decrease your immune reaction as well, especially steroids taken systemically, meaning IV or by mouth. Look, steroids are a big problem, and this is a controversial topic. If a patient comes in and they have pathology that's causing them pain,
right,
they have a problem that's clear and obvious, it's important to try injections, because a lot of patients, like 9 out of 10, get better without surgery. And the great Dr. Mena, who you have here on the show, does an amazing job at getting patients better without having to take the risks of the operation. But everything we do in medicine comes with a cost. And in terms of steroids, that cost, that side effect, that unwanted side effect is lowered immunity.
Right.
There's others. Steroids have been shown to also weaken bone. Steroids, the actual procedure of injections has some risks, so it's important to go to somebody who is very reputable. But that's why I think it's so important to really discuss with the patient the risks at length, so that they can decide, are the risks, the potential risks, worth continuing to suffer?
Absolutely. Now, and the next thing we want to do is see what those symptoms are for the infection so that patients can be aware if they have an infection and go to the doctor. So we have a graphic that shows some of these signs of an infection. The first one is redness and swelling. So as soon as you see this, but I mean, this is normal after a period of time of surgery. So when is it not normal to have redness and swelling?
Probably between 2 and 3 weeks.
Okay.
Definitively between 2 and 3 weeks. If the wound is still draining, that needs to be addressed. There's one caveat to that 2-3 week rule. There are some very aggressive infections that can happen literally within a day. These are the gas-producing bacteria. And what the patient will see then are bubbles forming around the incision, and the progress of redness and warmth and fever will be very fast, high fever. And those patients may present as early as 2-3 days after surgery, and that's an emergency. So that deserves a visit to the ER, not even waiting until morning to see the doc.
Straight to the ER.
Yeah.
Such great information right there about infections and surgery. So if you want to watch more videos like Dr. Brunsovanik's or other insiders that you've seen today, be sure to download the Health Channel app.